Good morning. This is Mary Landers. I am a reporter here at the Savannah Morning News, and we have with us today two guests from the Health Department. We have Chris Rustin, who is the administrator of the Chatham County Health Department, and Chris was appointed to that position in the spring. Is that right, Chris? But has been here before.
Actually, in the fall, but I was here.
Oh, in the fall.
Yeah,
okay, I'm sorry.
I was here prior to 2009.
Okay, and we have Dr. Lawton Davis, who is our director of the 8-County Health District here in coastal Georgia. So I was hoping that both of them could come together today and help us delve through the latest in both what's happening with the trends around COVID, and also look forward a little bit to the Thanksgiving and Christmas season, and give us some strategies for staying safe. So let's talk about the trends first, and I understand you also have some news about what's happening with testing. So let's talk about the testing, I guess, first. Okay. What's happening with testing?
I can take that one. So Chatham County, as we continue to offer testing at our Civic Center site, but one thing that we are moving toward is an appointment-based system. Right now, over the last several months, it's been a drive-through system where you didn't have to have an appointment. But when we look at this from we've been doing this now for 10 months, and we're trying to ensure that we can continue offering testing for the long haul for as long as it's needed. We have to start looking at our resources and maximizing the efficiency of our operation. And so starting next week, we are instituting an appointment system. That's a simple way to get a test. The appointment system has actually been implemented in all the other counties within the Coastal Health District. And we will still offer the same number of tests. Right now we're averaging about 1,350 tests a week, and we will have more than enough appointments to accommodate that. But as we look at this long term, we're really not sure at this point how long we're going to continue testing. We need to ensure that we have the resources in place, and with appointments we're able to monitor the traffic flow a little better. We're losing some of our logistical staff with the National Guard around the 1st of December, and so we're implementing this now to plan for when we don't have that sort of traffic control piece in place. Okay. But testing will still be available. It'll just be based on appointments, and the appointments are easy to make through either through the website, which is covid19.dph.ga.gov. It'll take you through a series of prompts and show you appointment slots that are available, or you can call our call center, and that number is on our website, and they'll make an appointment for you.
Okay, so you could get a same-day appointment?
Yes.
If one's
in
available.
most cases.
Okay, and it's still free?
It's still free to the public.
And what's the turnaround time looking like now?
The turnaround time, based on what I've seen most recently, has been, I want to say, within 24 to 36 hours. We've had a really, really good turnaround time with our lab. And so as it stands, that's still the turnaround time, and so we're getting results back really quickly.
Okay, I can confirm that with personal experience. I had a test last week, and it took 30 hours to turn around. Yeah.
Excellent.
Okay, so that's something new, just with the way the testing is administered. And those are the same kinds of tests that you've been doing. I've heard about other places in town are doing the 15-minute test, but you're still doing the swab in the nose.
That's correct.
Send it away, and you
Yes.
get the results later.
Yes.
Okay, so how are we looking here in Chatham County as far as the positivity rate and things like that, the cases that we're seeing? We keep hearing in the news about nationwide there are lots of hot spots, and I think it's got people nervous about what's happening here. So can you give us the lay of the land here as far as COVID goes?
Sure. You're correct that nationwide, obviously we've been, if you've been watching the news, you know that the U.S. is setting daily records, and in many parts of the country we're at levels that exceed where we were back in the summer. Here in Chatham, in Coastal Health District in general, and Chatham County specifically, we've been fortunate that we have not yet seen that surge. We have seen a very small uptick. One of the things we look at is called the 7-day rolling average and also the 14-day rolling average. Obviously, the 7-day rolling average is the average number of new cases per day for the most recent week, and the 14-day would be for 2 weeks. So what you would like to see is the 7-day rolling average be less than the 14-day rolling average, which would indicate that the most recent week was better than the week before. However, in the last 4 days, those numbers have reversed, and now our 7-day rolling average is slightly higher than our 14-day rolling average, which means or indicates that there is just a small uptick. Again, it's not, wouldn't call it a surge. It's not alarming. A lot of the other indicators that we look at still are, relatively stable and good. But that is just, it's out there, and most national public health experts expect that with colder weather coming on that we'll, see surges pretty much everywhere.
Yeah, can you explain a little bit about that? Why surges with cold weather?
Well, one of the key things is that with colder weather, people tend to spend more time indoors. And as we know, all other things being equal, being indoors in an enclosed space, sort of like where we are now, is not quite as good as being outdoors. You have less robust ventilation, air circulation, and that's one of the things. Plus, the virus tends to survive a little longer in colder weather. So those would be the main things.
I feel like I spend more time inside in the summer here because it just gets too darn hot to be outside. Are we a little protected there because of that?
Well, we really hope so, and I'm hoping for a very mild winter so that we can continue to have activities outdoors rather than everybody piling in together. But I think as we do, we need to remind people if you're going to be indoors in a gathering, the fewer number of people, the better. The larger the room and the better the ventilation, the better. And be sure to wear a mask.
Okay. And how is that going, the mask wearing? I feel like perhaps some fatigue has set in and it's not as uniform as it was at one time.
Yeah, I would agree. People are tired. There are some areas and pockets where people continue to be fairly vigilant and compliant with, wearing a mask. And a lot of the stores, storefronts have signs up, mask beyond this point, and that's good. But I also hear from people who've been downtown, in the evening and, walking on the street that sometimes there are not a lot of masks visible. So I think people are getting tired of it, and that's sort of natural.
Yeah. What would you suggest to people about that? Is it still important?
Oh, I think it's still very important. We've gotten good news recently, preliminary news about one of the vaccines, and the other one we're waiting on is the same type of vaccine as the Pfizer vaccine. It uses messenger RNA. And so hopefully we'll get good news about that one as well. And hopefully by sometime in December we'll have emergency use authorizations for at least one, if not both, of these vaccines. So my word would be, we see a light down there at the end of the tunnel. It'll be a while before there's enough vaccine available for the general public. We've been doing a pretty good job in Savannah and Chatham County as far as watching our 3 W's, wearing the mask and watching our distance and washing our hands. If we can persevere and hold on for a little while longer, hopefully the vaccine will be here, and that'll make a big difference.
How do you anticipate that vaccine acceptance here? I think I'm remembering that we had a pretty good childhood vaccine rate in Chatham County. Is that correct?
We have
just generally for the vaccines that kids get.
Yes, we do. When we do the school audits, we have good rates here.
Mm-hmm.
We do have some people that are opposed to to vaccines, and I think people in general will be, as with any new medication or new vaccine, there's going to be some natural trepidation about taking it, and I think that's why it's important not, for the drug companies and the FDA, not to cut corners. I think they need to do everything they can to assure the public that not only does it work, but it's also safe, and assure the public that, the all-knowing we are looking at safety data and monitoring for adverse effects. I mean, the drug companies and the medical community, healthcare community, has nothing to gain by putting a vaccine out there. It turns out to have a problem or just doesn't work.
I do anticipate that it would go to healthcare workers first.
Chris may be more in tune with the emergency preparedness side of things, but yes, I would guess.
Yeah, I think this is going to be a phased approach, as Dr. Davis had mentioned. In the beginning, there's going to be a certain amount of vaccine available. And to prioritize that, we're hearing that it'll most likely be recommended that we base that on a risk-based approach, where first responders, healthcare workers, and potentially folks in long-term care facilities would be prioritized in the beginning. But we haven't got that in writing. It's just been discussion. If we have a limited number of vaccine in the beginning, how do you maximize its use? And so that's kind of what we're looking at. And we still don't know how much vaccine we're going to receive in the beginning, and when we're going to receive it.
Right. A lot of factors still up in the air.
There is, and one thing I'd like to mention as part of our planning process, several of these vaccine candidates require extreme cold temperature freezers to hold them, and to get ahead of that curve, our district, the two large counties, Chatham County and Glenn County, have ordered 2 of the ultra cold temperature freezers that'll be in our health department. So we will be prepared to store the vaccine once it's distributed to us. And I think that's important because neither health department had the capability of doing that. And so we're trying to get ahead of the curve and make sure we have that capability.
How cold does it have to be kept?
Well, those freezers get
minus 80,
minus 80
Oh,
degrees.
okay.
Yeah,
so that's just not a normal freezer. That's something special.
And tangentially, that's another reason for going to an appointment schedule. Not only are there strict guidelines for storing it and handling it and taking it to a site where you're going to administer it, but they're multi-dose vials, and so you don't want to pop open a vial and extract one dose and have to waste the other 9 that are in there. So we want to be able to schedule and have the proper flow when we're using this thing.
So you'll already have that set up with
we'll
the
already,
testing, and
right. That's one reason for going ahead and transitioning to that now, so we can grease the skids, so to speak.
Do you anticipate that it would be the same at the administration would be at the drive-through at the Civic Center?
I believe so, as long as we're able to continue to utilize that facility. That's we've been fortunate in Chatham County to have that cooperation. We will be able to administer it in a drive-through setting, and also remember the larger hospital systems will definitely have the vaccine, and they likely will take care of their employees. So we won't be the only game in town.
And the vaccines that are in development, they're mostly a shot in the arm?
Yes, the first one, it's the Pfizer product actually is 2 injections. You get one, you wait, see 21 or 28 days, and then get a second one. Of course, it doesn't have to be exactly 21 days.
Right,
if you got it 22 days, that'd be okay too. But it does require a second injection for maximum efficacy.
Okay. Can you go back, Dr. Davis, to something you said earlier? You were talking about different indicators. Could you talk about a few of the other indicators, like hospitalizations, and how we're looking on those other indicators?
Sure. The hospitalization data that we display on our website really is, it doesn't take into account each day's admissions and discharges. It just looks at the total number of people reported by the hospital, who have COVID, who are inpatients. But it still is a very useful sort of rough indicator. And if you look at the graph on the website back in the summer, we were very high, and it hasn't been just a perfectly smooth drop off, but it's come down pretty nicely. There may be this little slight rise here recently, but again, like the other things we mentioned, it hasn't been dramatic. So hopefully it'll level off and continue to come on back down. Another thing we look at is the percentage of tests that are positive. The federal government, the feds, say that if more than 10% are positive, that's their proverbial red zone. That's a bad indicator. You'd like to have it less than 5%. Obviously, lower is better, and Chatham County has been in the 6.23 range now for several weeks, which is much better than we were earlier.
Well, at the height, what were we at?
We were well over 10. I'd have to look to see exactly. I can't remember exactly how high we got, but we were up there pretty good.
How do you control it with that for people who are just worried who are going back repeatedly for tests that they don't really have any need for? Or do you?
We don't really control for that. It's pretty much the number of people that have tests and the number that come back positive. We were at 17.1% on July the 8th. And on November the 6th, we were at 6.2%. So that's a significant drop.
And all of these things are best for understanding trends, is that correct?
Yes. When people look at the data, they need to look not just at the raw number, but also look at the trend. Is it increasing or is it decreasing? When we talk about that community transmission index, basically that's the prevalence of the illness in our community expressed as a rate per 100,000. In other words, how many people out there have it. And the Department of Public Health and the feds also agree that if it's over 100, that indicates a fairly significant burden, and that is, the threshold that the governor gave for allowing communities and counties to adopt local mask ordinances. We've been well over 100 for a long time, since back in late May or June. I can't remember exactly what our peak was, but it seems like it was 600 and something. We're down to about 134 now, so much better, but still well above the threshold, for allowing a mask. The other thing that we look at that we call the new daily case rate per 100,000, that is an incidence, and there's a little difference between prevalence and incidence, and it's hard to explain, but you can go online and read the definitions. The incidence is how many new people are getting it, per 100,000, and the prevalence is how many people per 100,000 have it. They're calculated differently. One uses the raw total number of cases reported in the last 14 days. The other uses the 7-day rolling average. And then each is divided by the county population and multiplied by 100,000. So they're not going to, match exactly. And it's conceivable that one can be in a higher zone and the other can be, you look at the color scales and all this stuff. One can be in another zone. And these metrics were formulated by different entities as well. So again, you look at the trends, and so if our community transmission index came down to 101 from where it is now fairly quickly, if you looked at that, that might be better than seeing somebody's go from 70 up to 99 fairly quickly, because we're 101 on the way down, they're 99 on the way up.
Mm-hmm.
I think I'd rather have my
Mm-hmm.
trend being downward. So that's why we say don't look just at the raw number, but also look at the trends.
Okay, let's talk about the holidays coming up. We were saying earlier, we can't believe we're still doing this. When I first started working from home, I thought I'd be there a week, and now it's going on 7 months, I think. So what are you suggesting people do, given our prevalence and incidence rates? What are you suggesting people do about Thanksgiving first?
Yeah, I'll take that one if you'd like. We recognize that these types of holidays, generally you have gatherings of family members. One thing that we recommend is that if you have a gathering, keep it small. Outdoors is certainly better than indoors, so we are hopeful that the weather will cooperate. But if you have a gathering indoors, try to have it in a large room with a lot of ventilation. We do recommend masks indoors. I think we have to also look at the different age groups of the folks that are gathering.
Mm-hmm.
The virus certainly can affect an elderly person with much poorer outcomes than a younger person potentially, and it can be spread asymptomatically, and so there's all kinds of risks that have to be considered. So I think as you have your gathering, think about those types of risk factors and plan accordingly.
You said small. Do you have a number in mind?
Not necessarily a hard number. The smaller the better, of course.
The more it's your core family,
That's right.
if you can limit it to the
Mm-hmm.
people in your household, that's
Mm-hmm.
even better.
Exactly.
Mm-hmm.
If you're importing relatives from other places, you don't know exactly
Mm-hmm.
what the community transmission was like there and what their
Mm-hmm.
exposure risk was.
Exactly.
How about some suggestions for kids coming home from college and how to stay safe with them coming back?
Well, I think the same principles apply. There's no way to know that if they've been exposed or not unless they've been tested and they have a positive result.
Mm-hmm.
And so I think you just assume that there's potentially a risk. And as you plan these gatherings, again, keep it small, keep it outdoors if possible. And just recognize that we're still unfortunately in the midst of this pandemic, and these public health recommendations are really our best tools for trying to limit the spread of the virus.
I was just talking to a friend whose college-age son, or both sons, I think, had COVID and had recovered. Actually, one had recovered very, very quickly. What's the thinking now on that situation? Is that person now immune or less likely to transmit it?
She would ask tough questions.
I'll let Dr. Davis take that one.
Well, we still feel that if someone has a documented case and they recover, they're asymptomatic, that they probably have some reasonable level of immunity, and if they're re-exposed within 3 months, we don't recommend that they go get tested unless they develop other symptoms. So in medicine we have an expression that we use that you never say never in medicine. Things are different, people are different, immune systems are different, but by and large, if somebody has recently recovered, they probably are immune, and it appears that from the preliminary data with the vaccines, that the vaccines are eliciting a good immune response. So only time is going to tell for sure. Mm-hmm. But yes, I think if somebody is documented to have had a positive test, particularly if they were symptomatic and then they got well, and it's been within the last few weeks, they probably are at very little risk of getting it again and or giving it to anyone else.
Okay. How about with other gatherings? So that's your family gathering, but then there are lots of other gatherings that happen around the holidays. I'm thinking of some things like, typically there's a big gathering in Forsyth Park, I think, where it's a big Thanksgiving dinner for the homeless. Are those kinds of things just out now?
Well, I think, one thing for any type of large gathering in a public place, the organizers need to ensure they're following the executive orders that have been issued, not only by the governor, but by the local leadership. And, if their gathering is allowable under those executive orders, then they need to strongly consider how they can plan it the least risky way as possible. Outdoors is obviously better than indoors, and so if a gathering has to occur, it's much more recommended to happen outdoors. But if they're serving food to the homeless, they need to ensure that people are socially distanced appropriately. That hopefully they're wearing masks, but and that food is being it's probably better if it's possible to prepare the food ahead of time in plates or disposable containers that can be handed to them versus having them walk through a line where they're potentially going to be exposed not only to each other but to the volunteers that are helping out. But we recognize that gatherings are going to occur during the holiday events. The organizers need to really work on a basic safety plan to keep not only themselves but the people that are attending, and follow the executive orders and the guidelines that have been issued by the city, the county, and the governor's executive order.
Okay. How about the Christmas shopping season is coming up? How about suggestions for how that's going to happen? What are going to be best practices there?
Again, if you're going into buildings, the shopping is certainly, buildings are going to be open. They're open now. Most buildings have a mask policy. Adhere to it. They're there for a reason, not only to protect the people shopping, but protect the workers. Follow the guidelines that are put out by the various businesses. Another alternative is order online. That could be a potential option. A lot of people purchase gifts online, and a lot of stores offer ways to purchase online or through some mechanism that way. But I think we just need to all remember we're in the middle of the pandemic, and while we want to enjoy the holidays, let's be safe about it and not bring the virus back to our families. And anytime you go out, there's that risk. So wear your mask, social distance, wash your hands or have hand sanitizer to try to protect yourself as much as possible.
The toughest question. I was at the mall the other day. I saw Santa's throne set up. What's your suggestion there? How do you visit with Santa this year? Or do you?
Well, personally, I hope that Santa socially distances and does not have lots of children in his lap, up close and personal. That'll be tough, but I think that it's just unusual times, and I think even the magic of Christmas won't protect us from the virus. So we just need to be careful, like Dr. Rustin said. You just wear your mask, keep your distance, follow the guidelines that are in place, and one other twist, you can order from a lot of our local stores. You can order online or by phone, and then they'll deliver to your car, so you don't actually have to go inside. That's just another option. If you don't want to throw all of your business to the online giants and you want to shop locally, you can still do it in that manner and support local business.
Yeah.
And I think we just need to all have a little bit extra level of patience this year. If you are in a line and your social distance, they're going to be slower this year. And so it's just something I would plan for ahead of time, that it may be a little slower, because everyone's trying to do what they think is right to protect their workers. And so plan ahead, have a little patience for the various stores that are going to be open.
Yeah, I don't want to go off on politics, but I think there may be an analogy. Some of the the polling places, in certain places where people were less strict about wearing masks and socially distancing, there have been a few outbreaks reported among polling workers. And so our people that are working in the stores at the checkout counters or assisting, they're going to be coming in contact potentially with a lot of people. We all just need to be cognizant of that and do our part. We may feel perfectly fine and yet be one of those asymptomatic carriers, so we need to wear our mask. I need to wear my mask so I don't inadvertently expose you.
All right. Do we have any questions?
No, they're all pretty answered about the holidays. So.
Okay. All right. Well, I would like to thank both of you for coming in. Thanks so much. It's good to see you both. Welcome back, Chris.
Thank you.
And stay safe for Thanksgiving.
Thank you.
Thank you.